Hello, everyone. I would like to congratulate RSSDI, particularly its dynamic president, Dr. Banshi Sabu, the incoming president-elect, Dr. It's not incoming president, he's already president-elect. President-elected. I'll start again. Hello, everyone. I would like to congratulate Dr. Banshi Sabu, President of the President or Chairman? President. I don't know why I make mistakes. Okay, delete all that. Hello, everyone. I would like to congratulate Dr. Banshi Sabu, President of the RSSDI, the President-elect Dr. Vasant Kumar, and the entire dynamic executive committee of RSSDI for organizing this wonderful RSSDI digital workshop on type 1 diabetes. We've had many conferences on different subjects, but a fully dedicated conference to type 1 diabetes is rather uncommon, although it is very much the need of the hour. Type 1 diabetes probably constitutes only 2 to 3% of all the people with type 1 diabetes that we see in our clinics. However, I'm sure all of you will agree that it's a very complex problem. It's also something which needs much more attention than the common garden type 2 diabetes. This is compounded by the fact that the majority of people who get type 2 diabetes are children and adolescents, and sometimes even small toddlers can get the disease, or I'd like to call it as a disorder. Type 1 diabetes, of course, requires insulin, and this insulin currently has to be given only parenterally. You can give it either through the old-fashioned syringe and the needle, or through the pen injectors. But today, we have various types of pumps and other devices through which the insulin can be injected. I have been in this field for about 50 years now, and what I have seen is a dramatic change in the way type 1 diabetes is diagnosed and treated, not only in India, but all over the world. 50 years ago, all we had was urine sugar testing to see whether one's sugar was under control or not. We had the old-fashioned Benedict solution, which is a blue-colored solution. Then you put 8 drops of urine in it, and then you boiled it. And if the urine changed color, it meant probably that your blood sugar is above 180. And with the increasing change in color, you could guess that your blood sugar is probably 200 or 300 or 400. There were no glucometers back then. Then came the glucometers, which empowered people with diabetes to test their own blood sugars. This was followed by one advance after the other. Towards the end of the 1970s, when you had somewhere around 78, 79, the 3 months control test or the glycosylated hemoglobin or HbA1c was introduced. This was a path-breaking advancement in diabetes, because now you could say with certainty whether one's sugar has been under control for the last 2 to 3 months or not. Various such developments took place. Today, we are in an era where we are talking about a fully automated insulin pump, a closed loop system, which not only senses your glucose level, but also can determine how much insulin is to be injected. So as you can see, the life of a person with type 1 diabetes has changed for the better quite considerably in the decades since I started my practice or even before that, when my father and the seniors in diabetology in this country started their practice of diabetes in India. So all this is good news. The other good news, which I will be sharing with you in a presentation, in a lecture which I'll be giving at this workshop, is that people with type 1 diabetes are now living longer and longer they are living healthier lives, and many of them are now able to completely avoid the complications of diabetes. Indeed, it is no exaggeration to say that my oldest people with type 1 diabetes that I know of are now nearing their 90th birthday, having got their diabetes when they were teenagers. Some of them have got diabetes for over 70 years, some of them for 60, 50, or more years. In fact, we have just published a major research paper showing that long term survival with type 1 diabetes is possible. And what is the secret of that? The secret is very simple, that they controlled their diabetes better, the HbA1cs were better, their blood pressures were better controlled, their cholesterol and the lipid profiles were better controlled, and most importantly, they visited their diabetologist and the diabetic clinic more often. There could be also other factors like genetic factors, which are also responsible for long term survival. So, overall, the good news is that if you get type 1 diabetes today in the 21st century, you need not worry at all. You can think of having a long and healthy life despite having type 1 diabetes. This workshop will be discussing all of these, starting right with the psychological changes that people have when they have type 1 diabetes, diagnostic dilemmas as far as type 1 diabetes is concerned, the proper management of type 1 diabetes, the monitoring of this disorder, and the various technologies which are used, not forgetting the role of diet, exercise, safe pregnancy in people with type 1 diabetes. The whole gamut of the treatment of type 1 diabetes is covered brilliantly in the 2 days of this workshop. I offer my heartiest congratulations in my capacity as the patron of the RSSDI, and would like to thank all the national faculty and the international faculty, and of course, all the organizers of the executive committee of the RSSDI, ably led by Dr. Banshi Sabu, the dynamic president of the RSSDI, for organizing this much needed conference. My heartiest congratulations and best wishes to all of you. Thank you. Harish?
Yes, sir. Shall we go for next
Efficient.
one, sir?
I think the first 1 minute I made 2, 3 errors. You can
Yes, sir.
cut
I'll
all
just
that
get it off, sir. Yeah.
and then send it to him. Okay.
Yes, sir.
So you can. So this will be title will be the when you send it, it will be um, Dr. V. Mohan's talk for the inauguration.
Yes,
Dr.
sir.
V. Mohan's talk for the inauguration. I'll type that also.
I
Dr.
just note
V.
it down, sir.
Dr. V. Mohan's talk for the inaugural function
Uh, Inaugural function. Okay.
of the T1D workshop. That will be the one which you're going to talk about now. Okay.
Yes, sir.
Now I'm going to get my slides. Share screen. Share screen. It's come now.
Yes, sir. Yes, sir. 1 second, sir.
Okay. I'll make it full screen.
Yes, sir. Sir, can you just click that near stop sharing? There is a button called hide.
Hide. Hide it. Okay. Okay.
So that
Right.
it won't.
Right.
I
Right.
just remove myself, sir. Then you can start.
Yeah. 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 I can't see you now, but anyway, you can. When I finish, I'll probably press stop share. No, now that stop share is not
Yes,
there.
sir. Yes, sir. Yeah.
How do I bring?
Within
How do I
four
stop in the
seconds.
end? Huh?
4 seconds you can start, sir. Start speaking. I'll just remove myself now.
Okay,
Right now.
that's okay. But how do I, after I finish, how do I exit this? Put escape, is it?
Yes, sir. Escape itself. It will come, sir.
Yeah, yeah, yeah. Okay. So I'll finish, pause for some time, then I'll put escape. All
Yes, sir.
right. Hello, everyone. Thank you for inviting me to take part in this very prestigious and well organized digital workshop on type 1 diabetes organized by the RSSDI. I would like to thank Dr. Banshi Sabu, Dr. Vasant Kumar, and all the executive committee members of RSSDI for inviting me to give this talk. I have been following the program of the meeting, and I find it to be very comprehensive. And therefore, congratulations to all the faculty from India and from abroad who have taken part in this. The topic of my lecture is long and healthy life is possible with type 1 diabetes. And I hope to convince you that even people living in India with type 1 diabetes can have a long and healthy life despite having type 1 diabetes. When you talk about type 1 diabetes, it's been known for many years, for that matter, even type 2 diabetes, that life expectancy in people with diabetes is decreased. The general consensus is that for people with type 2 diabetes, the life expectancy is reduced from 6 to, say, 10 years. In the case of type 1 diabetes, the figures are worse, and they say that life expectancy is actually reduced from 10 to up to 20 years. Now, this is mainly because of poor control of diabetes, and these are old statistics, and these are changing day by day. Having said that, however, long term survival of type 1 diabetes has now been reported in Europeans, and this has been going on for some time now. For example, in about 40% of European individuals with type 1 diabetes, there are reports that they can survive for more than 40 years duration. The golden years cohort provides a description of those who survive for at least 50 years, and that's why it's called as the golden years cohort. There are other reports like the Jocelyn Medalist Program, where in the Jocelyn Clinic in the US, they started giving out medals first for those who had completed 25 years, then those who completed 50 years, and then 60 years, and even 70 years with type 1 diabetes. In fact, a couple of people who developed the type 1 diabetes around the time when Banting and Best discovered insulin went on to live beyond 90 years of age. There are, of course, exceptions, but there have been reports of people living for a very long time with type 1 diabetes. However, most of these reports have been from US and Europe, and we were not aware of any such reports from developing countries, and certainly none from India. In fact, I was not able to find any reports from Africa or South America or Europe or from Asia and many countries in Asia and so on. And certainly there was nothing from India. Along with my colleagues, we recently reported on the clinical and biochemical profile of long-term survivors with type 1 diabetes, and we also compared them with a group of non-survivors. So the question we asked is long-term survival of those with type 1 diabetes possible in India also? The methodology we followed is that, in fact, I did this through the RSSDI. I wrote to almost all the senior endocrinologists and diabetologists in India, inviting them to let us know if they have any person that they know of who has type 1 diabetes and has lived for more than 40 years. We took 40 years because this is what has been reported in the West. And we also took 40 years because this is the cut point we used in our earlier paper on long-term survivors of type 2 diabetes, which became, as you know, a big hit. And the American Diabetes Association awarded me the Harold Rifkin Award after that paper was published. Now, this paper on long-term survival type 1 diabetes was recently published in the September 27th issue of Diabetes Technology and Therapeutics, published from the United States. This is the paper. As you can see, these are my colleagues. Dr. Shantirani from my center helped me, but we had Dr. Banshi Sabu, Dr. Satyanath Mukhopadhyay, Dr. Sudeep Chatterjee, Dr. Dharmarajan from Madras Medical College, Dr. Sunil Gupta and Dr. Sharat Panse from Nagpur. And these are my colleagues from my center. And we had Cheryl Salis, who gave me a lot of leads to type 1 people with type 1 diabetes, and of course, my own team from my center, including Ranjit and Anjana. So all of us got together and we reported on 76 individuals who had survived for more than 40 years. I think it's described better in the next slide. We are a total of 127 people with type 1 diabetes. This included 76 individuals with type 1 diabetes who had survived for at least 40 years, and we call them as survivors, and 51 individuals with type 1 diabetes who had unfortunately died with shorter durations of diabetes. That means shorter than 40 years. And I'll show you that in a subsequent slide. And they are referred to as non-survivors. And they all came from different diabetes clinics in different cities of India. So therefore, it is a pan-India study. Of these 76 survivors, 59 were from our center, from Dr. Mohan's Diabetes Specialty Center, which was a coordinating center for the study based in Chennai, and 17 came from other participating centers, 5 from the Madras Medical College, Chennai, 5 from Ahmedabad, from Dr. Banshi Sabu, 3 from Delhi, 2 from Kolkata, and 1 each from Mumbai and Nagpur. All the non-survivors were from Dr. Mohan's Diabetes Specialty Center. We took them because we had to have all the details collected in a uniform manner, and therefore we felt that from one center it was better to get the non-survivor data. Now, these 76 long-term type 2 diabetes survivors with more than 40 years duration included 58 who had survived for more than 40 years, 12 who have survived more than 50 years, and 6 who had survived more than 60 years. After we sent off this paper for publication and after it was accepted, we came to know of 2 more individuals who were subsequently found to have diabetes for even longer. They had more than 70 years duration with type 1 diabetes. And I'll show you pictures of these 2 individuals alone because they are not really part of this paper. But they are the longest surviving individuals I know of in India. And if any of you who are listening to this know of anybody who is longer than this or any of them would fit into this, please do get in touch with me. We will work them up later. Now, if you compare those who survived for more than 40 years with those who did not survive, the non-survivors, certain facts were very obvious. If you look at the age at diagnosis, it was lower among the survivors compared to the non-survivors who are older. But this could be just a selection bias. But look at this. The height of the survivors was 162 centimeters mean, which itself is a little short, compared to the non-survivors who were definitely stunted. Their mean height was only 148 centimeters. Look at the weight. The weight was 62 kg mean in the survivors compared to 43 kg mean in the non-survivors. And therefore, the BMI was 23.6 in the survivors, a healthy BMI, compared to 19 in the non-survivors. They're definitely malnourished. So that's the first point that I want to emphasize here, that the non-survivors, probably because they were irregular with their insulin or were under-insulinized, were shorter, they were thinner, they were malnourished. That means their immunity was not good and their growth was actually stunted. So if you see a type 1 person who is stunted in growth, it's one indication that in the early years they have not been treated adequately, and these are perhaps the people who also develop complications. This is a completely new point that we learned. Of course, the blood pressure was higher in the non-survivors, as you can see here, the systolic blood pressure. The sugars were much higher. HbA1c is much higher. You can see it was 8.4 among the survivors and 10.7 among the non-survivors. So they had very poor control of diabetes. Of course, the cholesterol was also higher, and I'll show you this in a subsequent slide. One of the interesting things that we found was that the HDL cholesterol, the good cholesterol, was actually higher in the survivors compared to the non-survivors. So the HDL cholesterol seems to be a protective cholesterol as far as the survivors are concerned. There was no difference in the C-peptide levels between either the fasting or stimulated between survivors and non-survivors. So it's not because that they had better insulin secretion or better preserved beta cell function. Because if they had, some people may say maybe they're not type 1 at all. They have good C-peptide, but there's no difference in C-peptide. So they are type 1s, But for other reasons, which I'm showing you now, they have managed to survive. There were not much differences in the other parameters, but statin use was definitely higher among the survivors compared to the non-survivors. Now, this shows you the prevalence of complications between the survivors and the non-survivors. As you can see, retinopathy was higher among the non-survivors. Neuropathy was higher among the non-survivors, although they did not reach statistical significance, probably because of small numbers. However, microalbuminuria was much more in the non-survivors, suggesting that they had not only early kidney disease, but also they might have had endothelial dysfunction. And if you look at chronic kidney disease, much more in those who were the non-survivors compared to the survivors. Peripheral vascular disease was also much more in the non-survivors. The coronary artery disease was also more, but this does not reach statistical significance. What are the causes of death among the non-survivors, the 51 people who died? The majority of cases died due to ischemic heart disease or coronary artery disease. One would think that only in type 2 diabetes you get heart disease. But if you follow them long enough, if they live long enough, they do die of coronary artery disease, ischemic heart disease. Renal failure, not surprisingly, was also a close second in these cases, showing that these two alone, if you take, it adds up to almost 50% of the cases. If you add other diabetes-related causes like DKA or hypoglycemia, then it's almost 70% of all the cases, the deaths are due to these three causes alone. Now I'm going to show you 3 slides which will clearly explain the difference between the survivors and the non-survivors. Survivors are shown in red and the non-survivors in green. And you can see this is the HbA1c divided according to the quartiles. Now, if you look at the first quartile, HbA1c less than 7.8, almost 40% of the survivors had good HbA1c control, or at least reasonable HbA1c control, compared to only 4% among the non-survivors. If you go to the fourth quartile, an A1C above 10.6, 50% of the non-survivors were there compared to 8% of the survivors. So it's very clear that the poor diabetes control is a major risk factor for the non-survival. Now, if you look at the LDL cholesterol, the same story, divided into quartiles, and you can see that the significant number of survivors had good LDL cholesterol, whereas if you look at an LDL cholesterol more than 113, almost 40% of the non-survivors had elevated LDL cholesterol. If you look at the systolic blood pressure, again divided according to quartiles, 43% of the survivors had a systolic blood pressure less than 123. Whereas if you look at the non-survivors, 31% had a systolic blood pressure more than 150. So again, blood pressure, the sugar and the cholesterol, what I call as the ABC mantra, the A1C, blood pressure and cholesterol, or the LDL cholesterol, all coming out to be higher in those who did not survive after having had type 1 diabetes. This is a little sobering slide which shows you at what duration of diabetes did they die in terms of percentages. So if you take 40 years, all the 100% had died because we took criteria that they should have not been alive for more than 40 years. So by 40 years, all of them are dead. But if you start looking at this, you just take 5 years. By 5 years of type 1 diabetes, 20% have died. Okay. Now this reflects either wrong treatment, or most likely they would have been lured away by other practitioners or quacks who said that insulin is not needed, insulin will cause cancer, insulin will damage your kidney, please stop this, and then took them away and gave them some other treatment, Siddha treatment, Unani treatment, Ayurveda treatment, or some quack treatment, herbal treatment, or no treatment. By this method, they actually kill the child. And that's what has happened in the majority of the cases. And then, as you can see, by 10 years, almost 40% are dead. And then it goes on. And by 40 years duration, all these 51 people had died. So what makes people with type 1 diabetes live longer? I already told you that. The ABC mantra, better glycemic control, better blood pressure control, better favorable lipids, but also lower prevalence of complications due to the ABC. I just talked to you about the two survivors who had lived for more than 70 years duration. I would like to thank Dr. Sharat Panse and Dr. Sunil Gupta for sharing the details of Mr. Hirachan Savane from Nagpur. So he is currently 88 years old and has had 74 years duration of type 1 diabetes. He got when he was 14. He's 88 today and is quite healthy. And the other person from Chennai, who is my patient, is Mr. K. Krishnaswamy, who is currently 86 years old and has completed 70 years of diabetes. This man used to work in the British Council earlier. So he got diabetes when he's 16. At 86, he's going strong and he's doing well. So here is evidence that our people have now started living more than 70 years with type 1 diabetes. As many of you are aware, in July of this year, we we awarded people who had survived more than 50 years or 60 years duration. In this case, we had given them what is called as a Dr. V. Mohan Victory Over Diabetes Medal. We have institutionalized this just like the Jocelyn Medal. And every year, we will be giving away these medals to people who have lived for many decades without any complications of diabetes. I'm not showing you all the awardees, but I'm just showing you two of these awardees who have lived the longest. So in conclusion, therefore, ladies and gentlemen, this is the first report of long-term survival of people with type 1 diabetes from India. And we report that the survivors had better glycemic control and blood pressure control, more favorable lipid control, and lower prevalence of complications compared to the non-survivors. However, in all humility, I must add that there could be other protective factors. There could be genetic factors. There could be a little unique biochemical factors which protected these people from developing complications. And currently, we are studying these factors to see whether early enough in life we are able to predict who are the people who are likely to have a long and healthy life despite type 1 diabetes. But in the interim period, let me tell you that if you look after your glucose levels, blood pressure, and lipids, and most importantly, visit your diabetologist frequently, keep in touch with them. People have a habit that once they control their diabetes, they can forget their doctor. It's a joke that you think of your doctor and God only when you're in trouble. Don't do that. Keep coming to us even when you're doing well, because that will help us to correct and make some small mid-course corrections, which will keep you on the right path. And thereby, it is my dream that one day, not only people with type 1 diabetes, but everyone with type 2 diabetes will not have any complications at all. And therefore, we can dream of a diabetes complications free India, and indeed, even a diabetes complications free world for everyone with diabetes in this world. Thank you very much. I'd like to once again thank Dr. Banshi Sabu and the RSSDI for not only organizing this brilliant meeting dedicated to type 1 diabetes, but also for requesting me to take part in this conference. Thank you very much. Harish?
Yes, sir. I have stopped it, sir.
This is not going off. Yeah, that's okay. So, yeah.
Shall I end the broadcast, sir?
Yeah, I think I can end the broadcast.